Anthrax is a serious illness caused by a spore-forming bacterium, Bacillus anthracis. Although anthrax affects mainly livestock and wild game, humans can become infected through direct or indirect contact with sick animals. Normally, anthrax isn't transmitted from person to person, but in rare cases, anthrax skin lesions may be contagious. Most often, anthrax bacteria enters your body through a wound in your skin. You can also become infected by eating contaminated meat or inhaling the spores. Signs and symptoms, which depend on the way you've been infected, can range from skin sores to nausea and vomiting or shock. Inhalation anthrax or pulmonary anthrax is the one we're going to focus on. In most cases, symptoms develop within 7 days of exposure to the bacteria. Bacillus anthracis is an encapsulated spore-forming, rod-shaped bacterium. Inhalation anthrax is the most deadly form. It's contracted through breathing spores. Once spores germinate within cells of the immune system, called macrophages, bacterial cells are released into the bloodstream. Anthrax toxin is composed of 3 individual proteins: protective antigen, lethal factor, and edema factor. The action by lethal factor rapidly blocks the signals that would normally recruit other immune cells to fight the infection. Edema factor, on the other hand, causes accumulation of fluids within and between cells and hence edema. The disruption of normal signaling pathways results in cell lysis and sudden release of messenger molecules and toxic shock. Although antibiotics may be used to kill the bacteria, the level of toxin has often become so high in the bloodstream that removing the bacteria alone is not sufficient to prevent death. Inhalation anthrax, even with treatment, is often fatal. Initial signs and symptoms of inhalation anthrax include flu-like symptoms such as sore throat, mild fever, fatigue, and muscle aches, which may last a few hours or days, or mild chest discomfort. As the disease progresses, you may experience high fever, trouble breathing, shock, or meningitis. When to seek medical attention. Many common illnesses start with symptoms that resemble the flu. Anthrax is rare in the developed world, and the chances that your sore throat and aching muscles are due to anthrax are extremely small. If you think you have been exposed, for example, if you work in an environment where anthrax is likely to occur, see a doctor immediately for evaluation and care. If you develop signs and symptoms of the disorder after exposure to animals or animal products in parts of the world where anthrax is common, seek prompt medical attention. Early diagnosis and treatment are crucial.
Hi Frank, I like your speech on biological weapons. It was brilliant, especially the part where you talked about anthrax. I'm really upset to see you go. We've been working together for 42 years now, and it's a shame to see you go.
Wow, thank you. I work really hard on it. Not everyone's smart like you, Charles.
It was a pleasure working with you, Frank.
Sorry, excuse me. I could have been a director if Charles never existed.
The patient shows signs of raised bumps, ulcers, and blisters, and black necrotic tissue in the center of the tissue. These symptoms are exposures to anthrax through the cutaneous route. 95% of these infections are cutaneous.
The patient is experiencing flu-like symptoms and also shortness of breath.
It seems as though he may have inhaled some anthrax as well, and not only just skin exposure.
We are dealing with weapon-grade anthrax. It is anthrax that is turned into a powder and used as a weapon. It's one of the most lethal production of anthrax. That is because anthrax has been manipulated to be more effective as a biological weapon.
A lethal infection from anthrax is reported as a result from inhalation of about 10,000 to 20,000 spores. Damage caused by the anthrax spores and the bacilli spread into the central chest cavity, which can cause chest pain and difficulty breathing. The bacilli eventually make it into the bloodstream and release 3 proteins named lethal factor, edema factor, and protective antigen. These toxins are the primary agents of tissue destruction, bleeding, and death of the host. The host will die if toxemia if antibiotics are administered too late.
Luckily, Charles got help early.
Is there any pain in your stomach?
No.
Have you had any bloody diarrhea?
No, not that I noticed.
Have you thrown up in the past 24 hours, and if so, was there blood in there?
Yeah, I did throw up, but there was no blood.
Okay, so we can confirm that the patient did not consume any anthrax, which is a good start. But once it enters the gastrointestinal tract, death is imminent in 25% to 65% of the cases. Dr. Juanes and Dr. Ramirez, I'm giving you this patient. I recommend giving him antibiotics. Keep me updated on his condition. I need to go see the other patients.
Beginning conventional antibiotics only treats the disease and not the toxins released by the anthrax.
Right now, the priority is to treat the disease process first. We are fortunate enough that he was brought in early. Administer the antibiotics first and then treat the toxins. Doctors, this is Ms. Pang. She works for the CDC and she's going to be here with us today for our weekly conference. Ms. Pang, this is Dr. Wences.
Nice to meet you.
And that is Dr. Ramirez.
Nice to meet you, doctor.
So the patient we're going to be discussing about today will be Charles. He's the one with the anthrax infection.
He was in his bed when his brother called the police. Reports say Charles received an anonymous letter a week before his admission to the hospital. 2 days later, he had a sore throat and muscle aches. The next day, he started noticing blisters and had a fever. A few days later, his brother came home and was wondering what Charles was up to since he hadn't seen him for a few days. When he entered Charles' room, Charles had a high fever and his blisters have turned into ulcers. At that point, the brother called an ambulance.
The patient came in with flu-like symptoms. He had blisters and a painless ulcer with black necrotizing tissue. The patient was infected with cutaneous anthrax as well as inhalation anthrax.
When he came in, the anthrax poisoning was still in its early stages, so we were able to give him antibiotics, penicillin. He is now recovering well. The patient experienced some side effects, but nothing too serious. He had the nurse educate him about prevention after exposure and discharge planning.
So when is Charles' discharge date?
Saturday.
Okay. Okay, good work everybody. Let's hope they catch the anthrax killer soon. The next patient we are going to be talking about is John Miller. He is the one.
We are all gathered here today because I want to share my research with you. I have found a way to prevent a grave national disaster using an anti-anthrax vaccine. This vaccine will be given to everyone to prevent the contamination if a person were to come in contact with anthrax. While researching, I have also invented a device that can identify a future bioterror attack. It will be a go-go gadget watch that will alert me when someone is coming in contact with anthrax. It will also show me the location of the attacker, so further action can be taken to stop the terrorist.
Die, Charles, die. You took everything from me. I'm gonna burn you into hell and everyone else. It's gonna burn, explode. Nobody can stop me. Die. I'm gonna watch you. Oh!
Go. Go.
Okay, I have to do it again. Okay, we're gonna do it again. 35% of these infections are cutaneous. We have to This is the one that came in with the anthrax infection. Start all over.